The Northern Territory has recorded 2 new COVID cases. Let's go live to Matt Cunningham in Darwin for us. Matt, there are concerns about some positive wastewater tests as well.
That's right, Gab. Yesterday when we recorded 0 cases, the Chief Minister was at pains to say that we were not out of the woods yet. Today you can see why. That positive wastewater testing that's come back for the Indigenous community of Binyari. Gab, that's a community that's just on the outskirts of Katherine, where we've seen most of the cases in this outbreak. Health teams are now in Binyari trying to test as many people as they possibly can.
There are about 200 residents in this community. A rapid assessment team has been deployed to Binyari this morning before the sun came up, and they are supported by the Worley Aboriginal Health Service. It's our intention to test every single person in the Binyari community today. We'll also get more people vaccinated there today.
Genomic sequencing, Gab, has now linked these latest cases to earlier cases recorded in the Greater Darwin and Katherine region earlier this month. They came after a 21-year-old woman flew to the Northern Territory from Cairns. Authorities say she lied on her border declaration form that she'd actually spent 4 days in Melbourne before travelling to Adelaide, then to Cairns and then to the Northern Territory, bringing the virus here with her. Now, there were 2 new cases that were recorded today, both in Katherine. One was a health worker from the Worley Aboriginal Health Service down there. The other was an Aboriginal woman. Michael Gunner gave an update on the situation there today.
The man was fully vaccinated. However, he also has other existing health issues, so he has been transported to Royal Darwin Hospital for treatment. The woman is associated with one of the positive households, but had not previously been identified as a contact, either casual or close. She took a COVID test because she had symptoms. I don't have her vaccination status at this time. The interviewing and tracing for her has only just started, so there may be some new exposure sites later this morning.
So the man who's tested positive has been taken to Royal Darwin Hospital. He's the second person in hospital as part of this outbreak. A 65-year-old Aboriginal woman is also in hospital. We heard the Acting Chief Health Officer, Charles Payne, today say that while her condition is stable, she has had some quite severe illness associated with the coronavirus. The other thing that's of concern for authorities here, Gab, is trying to find out exactly how far this virus has spread. They revealed today that there were 3 close contacts identified in the remote community of Yuendamu in central Australia. That's about 1,000 kilometres from Katherine, and also another close contact revealed in Tennant Creek. So they are still concerned that the virus may have spread further than that Katherine region. Of course, we've also had 6 cases recorded in the remote community of Robinson River. The number of cases remains relatively low, but it's fair to say authorities here are still very concerned about the situation developing in the top end.